Hi, I'm Dr. Robert Wong, GI hepatology from Stanford University School of Medicine and the VA Palo healthcare system. And today I wanted to highlight an interesting abstract. This is by Dr. Gao and colleagues. It looks at the impact of using quantitative surface antigen to really guide clinical care in patients with hepatitis B. First, some important background. Quantitative antigen is something that we can use to test. And the level of quantitative antigen has been shown to be very useful, not just in guiding therapy, but also in guiding the likelihood of achieving cure with different hepatitis B antiviral therapies. However, the utility of this test relies on having a highly accurate assay. So this study by Dr. Gao and colleagues looked at two different assays from Roche that is a quantitative surface antigen test. And what they showed was the importance of having a highly accurate and highly sensitive quantitative surface antigen. And they observed that when you use a highly sensitive quantitative surface antigen, it does better in predicting the likelihood of maintaining seroclearance and also correlates very well with the risk of seroreversion after someone has lost surface antigen. So really the key take-home messages from this important study is one, we should really be doing quantitative surface antigen more often because it can and does guide clinical care. But number two, and perhaps most importantly, the choice of the assay you use is highly important. You have to use one that's highly sensitive, highly accurate, because the level of detection does correlate to risk of maintaining clearance and the risk of seroreversion, which is something that we try to avoid in patients with hepatitis B. If you're interested in learning more about this poster, and that's by Dr. Gao and colleagues. Thank you.